Hi, this is Reggie from Restore Plus Physical Therapy, and welcome to today's tip of the day. As you all know, my mission is to end chronic pain, and sometimes when we have pain or inflammation, which usually causes the pain, people sometimes they get confused, or people get kind of like a bit too like they jump into a conclusion that they might have something immediately, right? So that's the reason why I created this video, because I got this question from quite a number of patients actually recently, and it's the question is it normal to have joints cracking or grinding? Let's say for example the shoulders, or most commonly it's the knees. My patients have been asking that because they're thinking, hey, you know what, if it's grinding, that means I have arthritis there, and then they're thinking, hey, you know what, if I have arthritis, I'm gonna have inflammation, I'm gonna have pain, and then I'm gonna have surgery later on. So they're kind of like thinking like one after the other. So that's kind of like the false belief that runs in their mind, that from that they can actually be having surgery sometime, and some of them actually kind of think that, oh, am I gonna have surgery now or next month, something like that. And the thing is this: as the body gets older, the joints wear out because of use, right? So that we know that, but that doesn't mean that you're gonna have surgery, you're gonna have a knee replacement or shoulder replacement. All right, so with the joints cracking, that means that the joint surfaces, they don't have that good fluid there anymore. So it's kind of like they don't have that lubrication there anymore. Okay, so that's why they have some grinding, and then they have sometimes even cracking. Let's say for example, for me, actually both my knees pop when I squat down. I'm not sure if that will happen now, but let me show you. So let's say if I squat all the way down, so I actually didn't pop right now, maybe because it's the end of a treatment day for me, so I've been actually kind of moving around. But usually when I do that, especially earlier in the day, both my knees will pop. When I go down, they're like pop, pop, one after the other, and sometimes one, but most of the time it's both. Now, is that dangerous, or is that going to lead to surgery? My answer there is no, not necessarily. All right, yes, so if that's the case, you have that popping, you have that grinding, meaning the joint surfaces are not very smooth anymore, you don't have that normal lubrication there anymore. So that, yes, so that is a yes to that. But does it mean that it's something bad? For me, what my answer there is, if it doesn't occur with pain, then I tell people not to worry about it. That's all right. If you have that grinding and you have that popping and it doesn't occur with pain, you're okay. I wouldn't lose sleep over that. I wouldn't stress over that. Okay, that's just part of normal wear and tear there. Okay, so there's no pain, meaning more likely than not there's no inflammation in there. Usually there's going to be no major tears in there, so that will not lead to immediately to like having serious injury, inflammation, swelling, pain, or surgery. Okay, so that's something that I want to share with everyone, so that way they can have some peace of mind that they're not going to worry about thinking about every other thing now that might lead to surgery, just because they're having popping, grinding in the knees, or let's say the shoulders. Okay, so I just want to let everybody know that. And if you like this video, feel free to leave your comment below, and share this with everyone you know, family, friends. And you can follow us on Instagram, you can like us on our Facebook page, and you subscribe to our YouTube channel. I'll see you on the next video of how to end chronic pain. Stay safe and stay pain-free. Bye.